Hey everybody, you may remember Dr. Craig Volsky. He has been around on and off here at Turning Point Chiropractic, and we are so delighted that he is able to come and talk about his osteoporosis program that he has at his office, Be Strong for Life. He's right here in Lincoln in the Piedmont Center, and someone very close to me has actually had a great experience at his office going from osteoporosis back to osteopenia. And so actually able to build bone density. And Dr. Craig, I'm so excited that you get to be here and tell us how it's done.
All right.
All right, well, let's welcome Dr. Craig.
Okay, so just to start off, so you realize by the time this 30-minute presentation is over, there will be about 100 people that have broken a bone just in the United States alone. About 40% of women and about 20% of men that are age 50 or over will have broken a bone also just from osteoporosis fractures. So it does pretty much remain invisible until this healthcare crisis that we're in. It remains invisible up until we have a broken bone to really alarm us about it. So what I want to do today is just teach about like an alternative treatment plan that we do at our office and how we reverse the stages of osteoporosis or osteopenia and catch it before it becomes a big thing that can hinder us down the road. So start with really what is osteoporosis. And osteoporosis is really just when we have the bone mineralization just basically depleting over a lifetime. And if we look at men and women, men start with a little bit more bone density in general than women. So they go down as time goes by anyway, but women start with a lot less, so they're going to be more apt to have osteoporosis than men. So a lot of people don't know really what it looks like, so I'll show you a couple pictures of what osteoporosis is. And if you don't know even the difference between osteoporosis and osteopenia, osteoporosis is more of the severe kind. Osteopenia is kind of the precursor before it becomes osteoporosis. So on this picture here, if you look at the far left, that's going to be a normal bone. You can see inside the femoral area in the greater trocar of the hip, there's a good, nice function, a lot of trabeculae, which is just basically kind of the holding blocks of the cells of the bone that make it nice and strong. The next one over is just, as you can tell, it's lost a little bit of bone mineralization. The next one is definitely an osteopenia. And the one on the far right is going to be an osteoporosis. So you can just really see from the far left to the right just how much that has changed. Another good picture is this one here too. And if you look at kind of the middle spots right there, just taking a chunk out of the body of that bone. And the top one is going to be a healthy bone. So you can see that there's holes in there, but that's just for vessels to get nutrients and stuff to the bone. And the bottom one, you can see, has a lot more gaps in there. But I also want you to notice that there are lines kind of going straight up and down. That's just the load on the bone, and that's the only area part of the body that is actually strong enough to kind of hold it. Now, when that gets bad enough, that's where we have the fractures and everything. So ideally, we want to try and keep that bone closer to the top picture and not at the bottom one. Okay, and then how is the condition of osteoporosis rated? We do it with a T-score. That's pretty much what I use to tell a starting point, maybe a finishing point if it's getting worse, getting bad, or anything like that. And so the numbers, what they show, at the far left, the normal bone is going to be scored anything -1 or more. So that'd be -1, 0, 1, 2, 3, 4, etc. The osteopenia will actually be scored between -1 and -2.5. So if we fall in that range, that's going to be where we're osteopenia. Again, that precursor to osteoporosis. And then the osteoporosis is anything 2.5 or less. So -2.5, -2.34, and so on. So that just kind of is our range. And so I'll get to a little bit later. I'll show some examples of even some patients and how they've changed and everything too. Okay, and then the next one is traditional medicine treatment. How does it really work? Biphosphonate, that's traditionally one of the main drugs that they've used over the years just to treat medically from medicine to try and rebuild bone tissue. The problem with that, one, you can see all the side effects from heartburn, upset stomach, nausea, diarrhea, constipation as well, but that last sentence on there, the major effects include femoral fractures and jaw problems. Jaw problems have been a big issue with that. But if we're trying to get a medication to help bone structure, why are we having femoral fractures just at the same rate as if anyone took no medication at all? So the problem with the DEXA scan, or I guess these drugs, is they in a way trick the DEXA scan. So it lays down like a layer of kind of cheap, flaky bone. And so when the DEXA scan takes the picture and try to see how much bone density it has, yeah, it says that it has more bone, but at the same time, it's just a real flaky kind of bone, and so people are still getting the fractures and everything. So that's why I've got into this too, just to really help reverse that without the medications. Okay. So what other options is there to reverse osteoporosis? A lot of people have done supplements or weight training and things like that, but there's really just one more option that people just don't know. And even with like supplements and weight training, for how great they are, they can maybe assist in bone, but they're not gonna ever just take someone from osteoporosis and put them back into a normal phase. So the program we do is called Be Strong for Life, and it's basically a highly efficient, medically supervised fitness and wellness program. What's nice about it, it only takes about 15 minutes a week. You come in once a week only. We need a good week just to repair and recover. And I'll talk about the system and how we do it here in just a little bit. But what's nice about it too is you just kind of wear whatever you want. You don't have to wear gym clothes. People have come in suits and stuff after work. People have come in gym clothes, just whatever. So it's nice. You just come as you are, and it only takes about 15 minutes to get through there. Okay, so the benefits of the program, obviously, to increase strength, structure, bone, muscle tissue, the joints, improve balance, that's a good one. Fall prevention is a great one. And really we do this at any age, or you can. And I've heard stories of people even in their 20s doing it, not just because they have bone density, just to try and keep healthy bone. And I'll talk about a patient I have at the end of the slides here, who started in her mid-40s with osteopenia and how well she's doing now. So that's some of the benefits. But it's not just the bones. It's also, you have to realize, the ligaments and the tendons, the tendons that hold the muscle to the bone and the ligaments that hold bones to bone. We get a lot more strength in those and a lot more durability in those. And really we just want to protect the joint. So there's a lot more benefits of just the bone. We can actually build strength and everything too. Okay, so structure dictates function, for sure. I mean, we attain this with that, and you'll hear in my office, you probably heard Dr. Lynn say before, structure dictates function. Now we'll talk about it primarily as on the chiropractic side, where the structure of the spine, the postures, really do play such a key role in how well the nervous system functions. On this case, however, we want the structure to be nice and strong, and that obviously is the bones, but for posture, for muscle strength, the skeletal system alignment, joint function, and all these are to increase the overall well-being of the nervous system too. Okay, so loss of structural integrity. And again, that sounds like a lot of what Dr. Lynn has said before in the past too. I'm sure you've heard him say that many a times. But more so, loss of bone density, poor posture, skeletal misalignment. It really increases that aging process a lot quicker. And again, the nervous system is really what we're hitting too. We really want to make sure that that's not as compromised as it could be with deteriorated bone tissue. Okay, so the symptoms of a weak neuromuscular, I mean, there's a bunch on there, from fatigue to minor aches, pains, joint pain, difficulty sleeping, anxiety, stress, mental fog. Those are all true, and just the list goes on and on and on, just like any problem with the body. So this can kind of help with all of those areas, not just getting our bones back on track. Okay, so again, the difference between osteoporosis and osteopenia. Osteopenia is just that beginning stages where the bone has lost enough to where it is starting to get a little brittle, and just definitely a warning sign because we know which way it's going. And that's where, if we can catch it even in osteopenia and just stop it, we can really help prevent a lot of damage down the road. Many times we reverse it into normal. Many times we just stop it right where it's at. But yeah, and then osteoporosis obviously is where there's major risk factors for fractures and things like that. And speaking of risk factors, lack of exercise or low quality exercise, poor nutrition, low vitamin D, mineral intake, smoking, excessive drinking, that can all rapidly speed up the osteoporosis. Females are at a greater risk, just like I explained at the beginning of the presentation. And then genetics, just being small framed, you're going to be a little bit more at risk too. and family history as well. Okay, so this picture right here, I've had a few family members, just I remember as a little kid, just growing up, that they basically went right through this. I remember as a kid when they were vibrant, walking around, doing everything. Then I remember the time that, okay, now they had to start using a cane, never really went away from that, and they kind of went to a walker, and just each time they're hunching over a little bit more, and eventually they've gotten into a wheelchair itself. And that might be because they've had a hip fracture. Sometimes that happens. Other times it's just they've gotten so weak and brittle that that's just that kind of progression. So at what point do we intervene there? We want to do it, as early as we can with chiropractic care, with doing something like this, whatever we can do, health, nutrition, wellness, whatever we can do to preserve, because obviously quality of life on the left is going to be a lot better than the quality on the right. Impact on life. So just some interesting statistics. 10 million people have osteoporosis. Of that, 8 million are women. 34 million people have low bone mass, or the osteopenia, that kind of precursor. That just is a ton of people. 40% of women over 50 suffer from osteoporosis fractures in their lifetime, like 20% of men do too. So we really kind of get those ages. We want to get a DEXA scan to make sure. And then each year, so this is this very last slide, just the bottom of it, if we take heart attack, stroke, and breast cancer in women and we combine it all together, the risk of suffering a fracture due to osteoporosis is even greater than all those combined, which is just very staggering, because that's what we all hear about is, the breast cancer, heart attack, strokes, and all that stuff. So something very, very much so that we should take into consideration. Fundamental loss of structure. I would say of all the slides, this is really the nuts and bolts of what it comes down to. Where it says max load must be regularly applied, I mean, that is really what it is. And so that's where I talk about, at our office doing the biodensity versus just weight training. A max load means I'm pushing as hard as I can and nothing's moving. If I go to a gym and I do a machine or any free weight or whatever, as long as I can move that weight, it's not a max load. It might be heavy, but if I can move it, it's not a max load. So that's what we're really after. And even on the Surgeon General's website alone, it says the max load is the only way we can actually start to reverse the declining of bone density.
So on that maximum load, is that a lifting, like you can't even lift it, or is it because you bench and push?
Yep, so there will be 4 exercises. I think it's coming up here real soon, and it will explain it all. But that's a great question, because we want to hit the spine, we want to hit the hips, we want to hit the wrists, because those are the most areas that people are going to have fractures. So if we can really engage on those, that's where those bones are really going to start to reverse and get good. So it's a great question, and we're going to answer it.
Okay.
Yep. But I love that slide, because that is really the keywords, max load. So how do we do that? So high intensity, short duration, measured recovery. So what this slide is basically saying is, I'll try and do this backwards, but if we take a graph, I should have brought like a board or something. We take a graph and it's going this way, and on this one is the intensity part, and then this way is going to be the duration, or how long the exercise. If you think of like running a mile, it can be intense, but it's going to be semi-intense, but we can go a long ways. If we break that down and we do maybe like a 100-yard sprint, okay, now it's going to be a little bit more intense, but the duration is going to be a little bit short. On this program, it is 5 seconds of intensity and stop. So that's how quick it is.
Yeah.
And so the max load under an intense force, under that short duration, is really what we're looking for to change that.
Oh.
Yep. So, so that is basically that. And then the other key, you'll hear me talk about bone and getting the bone to come around. But one of the other factors too, like I talked about earlier, just really protecting the joints, the musculoskeletal system. This right here, a typical muscle cell in figure 1, the little yellow things, they just represent little myofilaments, little bands of muscle tissue. And figure 2 represents a lot more of them, okay? And so if we just, do nothing, we have muscle, we have the myofilaments and everything, but if we're doing this program and everything, those muscles are actually getting stronger too. And not bigger, just stronger. So if you think of it like, this finger is a rope and this finger is a steel cable. They're the same size, but the steel cable is a lot more dense. Or like a ball of yarn in a baseball. Same size, the baseball is a lot more dense. That's what we're trying to do. So no one gets big or bulky on here. They're just getting stronger because we're using those muscles so intensely.
Does it increase, so you have the smaller dots and more dots, are you increasing muscle cell?
So to
Or
speak,
they just
making them bigger. I mean, we have what we have, but what we do have, it's going to make them a lot more efficient, a lot more stronger. Yeah. So, okay. So how do we go about this? The natural solution. Basically, we're going to apply cutting-edge exercise science, maximum exertion, short duration, like I mentioned. It's very safe, which is nice. We totally set you up according to your body type. Some people have longer arms, some people have longer torsos, longer legs. Some people have different strength, or maybe they have a shoulder injury. So we take all that into accountability. So when we take somebody through this, they know exactly that they're in a good position for them. So we definitely take them through that. And regardless of age and fitness level, anybody can do it. But it is an optimal training in the least possible time with a maximal benefit for life. And so that's what's nice. Yeah. So it is great. I've been doing it for probably 15, 16 years now or so. So we've had a lot of good results over that time. Yep. And then types of force generated. So to kind of answer your question, there's 3 kinds of contraction. There's going to be concentric. So if I'm lifting this and say it's just something heavy, as I lift, that bicep is going to shorten through that whole contraction. Okay, so that's called concentric contraction. Isometric, the middle one, would be if I'm just holding it here, but there's no movement. The muscles are contracting, but there's just no movement. That's going to be isometric, and that's what the biodensity machine does. We also have a program that we do a little eccentric contraction too. So that would be if I start here, and as I lower it down, the muscle's still contraction, but it's lengthening through that contraction. So those are the 3 ways that a muscle contracts, and we're going to hit them all. Okay? So when we get to the power plate, Dr. Lynn's got 3 of them here. This is probably, before I had the biodensity, probably my favorite thing in my office. I just love them. I do so much postural exercises on them, core exercises. And what's nice about it is when you're doing whole body vibration, our machines, we usually keep it at about 40 hertz, and so that means it's going to go up and down, forward, backwards, left and right 40 times per second. And when it's going 40 times per second, it actually is kind of allowing those muscles to contract about 40 times per second. And so we can just get so much more efficiency and use out of it. So you're going to get about 95, so any muscle you're engaging through the power plate, you're going to get about 95% of that muscle engaged. Or if you do the same exercise off the power plate, you might only get to about 25% of the muscle engaged. So that's what I love about them. So if you guys had to get on them, just get on them, But with doing, certain exercises, I mean, you can get some good benefit just standing or do minimal, but if you're doing posture or strength type stuff, that's where the benefit really occurs. So that's the power plate. The benefits of whole body vibration. So I'll just read through these. They're going to improve balance and stability. They're going to increase mobility and flexibility. They're going to increase strength and endurance. Injury prevention. The stronger we are, we're not going to get injured as much. Improve sports performance, and then decrease pain. But the balance and stability is one of the key ones, especially a lot of the people that do it, because they don't want to fall. They want to be comfortable when they're walking, and that's what we're trying to do too. Is just we don't want someone to be apprehensive walking or going, walking around their kitchen or walking into a restaurant or whatever. We want them to feel nice and stable. Okay, so how do the power plate affect the muscles? I don't know if you can read that. I'll just kind of go through it. But the cellular mechanical strain, so that's the vibration through the whole entire skeletal system. We're standing on there, we're getting those vibrations and everything. What the power plate's benefit of the whole program is it's going to strain the osteoblasts, which is basically stimulates bone building. So you're going to hear osteoblasts, which build muscle tissue or bone tissue, and osteoclasts, which kind of inhibit it or break it down. And then the G forces. The G forces is that middle one, and that's 2 to 3, about 2 to 3 times G's of force. And so what that does is it tricks the body into feeling that it's actually heavier, so the muscles have to work a little bit harder. So that's going to build a little bit more muscle a little bit more efficiently. That's why I like the power plate so much. It's just from stability and balance, it works so good. And then there's active and passive, and so I kind of hit on this a little bit, but passive would be if I just stand on there, I'm probably not going to get a ton of benefit because I'm just standing. Now you can get some lymphatic drainage, some benefits and things like that, but as far as getting muscle to get stronger and get that to go around the joints to be a little bit more efficiently. Doing like core exercises or just holding onto the platform and doing some squats, do push-ups or whatever it is. It's really going to take it to that next level. Okay, now. Okay, there we go. Now to answer your question. So there's 4 exercises. Yep, there's 4 exercises that we do. So in the upper left, you'll see an upper body press. And what that means is it's just an isometric, kind of like a bench press or chest press where you're just pushing as hard as you can, okay, for 5 seconds.
That means moving, right? But you're pushing.
You're just pushing.
The machine is resisting or something, right?
The machine is resisting, and the machine is actually taking, on all these exercises, the machine, we always start people at 5 seconds. Then we move them up to 7, then 10, and that's about kind of where we stop. But we start at 5 for at least maybe the first 4, 5, 6 months. Some people we can take through a little bit quicker, some a little bit less. But this computer reading, so like this little dial right here, it's gonna take 30 readings per second. So throughout the whole exercise, every second is taking 30 readings, and then it's gonna kind of average it out throughout the whole 5 seconds, and then kind of tell you how much force that you've pushed. And then it keeps track of all that, so you can see from time to time how you've done. The second one in the upper right is more going to be like a leg press where you're just sitting and you're just pushing straight out, again isometric, just pushing as hard as you can. Computer takes its 30 readings again. Great for just the hip, the neck of the femur is where a lot of fractures happen and everything. That is fantastic for that. The body, the lower left is going to be the body core pull. And so it's basically you're standing or you're sitting in the machine and you're pulling down with your arms and you're driving up with your legs. I always tell people, try and touch your elbows and your knees together. You're never going to be able to do it because we strap you down and everything. But that's what we're trying to do, and that's going to really help the spine. So,
Really?
Yep.
Not for alignment, though. Just
Not for alignment, just for strength, for bone growth,
Right.
and for like musculoskeletal, like tendon, ligament, like tightness around the joint to strengthen and reinforce that. And then the whole body vertical lift, the lower left, that's going to be more like lifting a wheelbarrow, but you can't move it. So before you lift it and walk, you're just trying to lift it, but you can't. And that's going to be how that one works. So all 4 of those, that's pretty much it as far as the biodensity machine goes. Do you have a question again?
No,
Okay.
I'm just going, that's a hump.
Yeah. Okay. Very good.
Fascinating.
Yeah, it is. It's
5
very, very
seconds.
interesting. 5 seconds. Yep. So it is safe and customized, like I said earlier. We set up everybody. I take everybody through that and make sure all their settings are good. And then we'll check them every once in a while too, because sometimes as you get stronger, you might be pushing a little bit harder. You might be using your muscles a little bit differently. Sometimes we need to change the setup. So for example, like on the leg press, the one that she's doing there, as they push and get stronger, they'll actually push back into the pad a little bit more. And we never want their knees to be fully extended. They could just be pretty, cause injury or whatever. And so if they're getting close to that, then we actually move the machine up a little bit, or we have little pads that we put in there just to make it so when they push, there's a little bit more knee bend in there.
So what if one leg is a implant and the other leg is
We'll see
Bone
that
on
a
bone?
lot. Well, and that's,
obviously one the left, the back?
yeah, and we have to be careful of that. I mean, I've had people like wear compression around it. Sometimes they just do push harder with the other one. You'll still get good
Yeah, but
benefit.
you still don't balance the body then.
It's not balancing the body, you're right, but it's still better than nothing. Still better than nothing. And I haven't really seen any, I mean, I have a lot of patients do it. I've never seen anybody's posture totally change or a hip level change. I've never seen any of that because again, they're not standing weight bearing on that. And the vertical lift, the last one they're doing it if they have to wear a heel lift, they're wearing a heel lift as they go through it. So now I have had a couple people where I put like a pad maybe on one side because it's a little bit more comfortable. Some people on the core pole, they have some rotation, so I'll put a pad in there. So I try and get it as ergonomically sound as we can. But again, when we push as hard as we can, a lot of times those natural postures where they are will come out. So we just kind of adapt as we go. So we're always listening to them. We always tell them to just tell us how you're feeling. Does this hurt? And do we need to make any modifications? So I'll look at the main ones that I see, but we also want to hear from them, too. Sometimes with shoulder issues, we just raise it up a little bit higher and takes a lot of pressure on your shoulder. Other people, they don't even do the 5 seconds. I mean, we might have them do it like 2 or 3 times where they're pushing, but not at a max load. So it's still better than nothing. but at the same time, it's just too, we don't want it to have any injuries or shoulder stuff, so we just kind of use it almost as like a rehab for them.
Huh.
So, and then this is the chart I was talking about, and we have a new software now. I should probably put the new one in there, but this is basically the idea. And so it's got the 4 exercises there, and you can see how those lines are kind of going from the left up to the right. So this is where they started, this is where they've been at, and so it's just showing kind of a constant increase like that. So it's a little deceiving because you're never gonna have somebody that gets stronger every single time that they come in. Like, I could never do it every week and get stronger every single time I come in until I'm as strong as like Arnold Schwarzenegger was in his prime. Like I'm physically not gonna do that. And so really what we look for is you'll see a big jump right at the beginning. And then what we want to see is we want to see a nice level line. So we can see maybe 2 or 3 months where it's nice and level. That way I know, okay, they're at their max load. Plus I know that they're giving it everything that they can each time. So, so for example, if someone kind of just have their graphics kind of up and down, well, probably in some of these, if there's an anomaly, like maybe they're tired, maybe they didn't sleep good, maybe they ate something bad the night before. Yeah, you'll see a dip from time to time. But overall, the whole general line, we like to see it flat after they've been on it, for a few months, because then we know they are pushing as hard as they can. Now, I also have people, that are in their even 90s now doing it, and they started when they were in their 70s.
Wow.
Well, they're not as strong, obviously, in their 90s as they were in their 70s. So if you look at their charts over the years, they really went up, and then they were level for a while, and just maybe over the last couple of years, they've kind of been going down just a little bit, and that's just natural.
That's just part of aging.
Yeah.
It's not that
Yep.
the machine can't keep you
Yeah.
stronger.
But it will keep them stronger than if they hadn't done
than
it.
it hadn't done it.
And a couple people they've had falls, they've tripped over a curb or whatever, and in their mid 80s or whatever, hard falls didn't break anything, and they come tell me about it, and they say they guarantee just doing this program has really helped them not get those fractures and everything. So, okay, so what can you expect? Just dramatic strength increases without building bigger muscles, improved metabolism, increased energy, improved bone density, focus, concentration are some of the benefits.
It seems like you would lose some weight in there if you're
Well,
increasing
I mean,
metabolism.
I wouldn't say I've had anybody like lose weight. Now, a lot of that's going to come with the nutrition and other things that they do.
Yeah.
But theoretically, by building maybe a little bit of muscle, having a little higher
Or
metabolism.
even the machine over here. One
Yeah.
of the things that lists is losing weight. Now, I don't know if just standing there.
Well,
it
like
doesn't do that, does it? I mean,
I would say probably not. I mean, I have people that have been on it a lot, and I wouldn't say they're using it as a weight loss, program or whatever. So, but this one, bone to age force. So this is kind of what I was talking about too. Like, if you have somebody in their 20s or you have somebody in their 80s, okay, you're probably going to get more, maybe just even say 40s. You're probably going to get more force out of somebody in their 40s than maybe their 80s. Just naturally, they're going to be a little bit stronger, so they might show better improvements at a young age than if they start when they're like 85 or whatever.
Sure.
But the other thing too, the muscle chart, where that says like 22 to 51% increase, it does keep track of how strong we have been getting. And I'd say most people are probably actually over that have come into our office where it keeps track of percentages of increase. But that is a little off too, because the first time they do it, it's the first time. The second, third time, okay, now their brain neurologically knows how to recruit a little bit more muscle tissue, so they'll make a lot more gains after that. Okay, this one, I'll just kind of go over it real quick. This is the one that I'm really going to focus on. And so this is just some of the research that shows how people have done. So the top left one, the independent clinical research, it's going to show that there's some pretty good bone mineral density change. The T-score is actually shown a little bit too. It doesn't show probably as good as what it totally is if someone is doing it pretty regularly, because that statistic is taking everybody that's done it, the ones that have been compliant, the ones that haven't been compliant, and they average it. So the second one down is going to be the ones that Biodensity actually does for their marketing and everything. But what they did is they took the ones that they know have been compliant, so they know, okay, if you're compliant, this is what we're going to get. And then the bottom one is going to be more of an anecdotal one, where it's going to show a lot higher increase. But again, those are just a one-off, like, hey, this person did this great. Not everybody's going to do that. Or maybe they had some kind of bone issue or whatever that got resolved, and then they were able to, put a little bit more force in there like that too. Eccentric training, this is the the React Trainer. Basically what this does is it's just kind of a little machine that just kind of goes up and down like this. And so the best way to explain it is eccentric contraction. If I jump off something and I land, these muscles are gonna lengthen to kind of cushion that blow of me landing. But we don't want to just jump off a chair over and over and over again to get that, because that's gonna be bad on our knees and our ankles. So what this does is as it goes, you're basically, you know, it basically looks like you're doing this on there, but it's basically working the intrinsic muscle contraction. That really helps with hip strength, quad strength, and all that kind of stuff. So the benefits of the eccentric training: safe rapid stimulation, load absorbing, for balance proprioception, functional, just like all the other stuff. It's just kind of takes it to the next level. So the complete system, the balance strength, bone health, fall prevention is what we use with the biodensity, the power plate for the whole body vibration, and the eccentric contraction with the React Trainer.
And that's 15 minutes.
Yeah, to go through all it takes about 15 minutes to get through. Now I do have other people that like to hang out and play around on the power plate a little bit longer, and I'll
Right.
always let them.
Yeah.
Yep. Okay, so some patient results. I'll kind of skip through these real quick. This one, I'm not going to read, they're a little fuzzy, but what's nice about Jan, she had a huge improvement. She had taken some time off, went a little down, and then she, you know, maybe like a couple years, and then she started doing it again. So when she started up again, she wasn't as bad as what she was, but she did lose a little bit, and then she kind of gained back as she went. Dee, this lady, this is a good one. She was at 65 years old. She did not have osteopenia or osteoporosis.
Wow.
She didn't want to get it. And so she's been doing it. She's one of my first ones to do it. She's probably doing it 15, 16 years. And she's still in the normal range because she started before she ever got bad. Shelly, this is another one. And this is the one I was talking about where she was in her mid-40s. They had osteopenia.
How
Just
did
in,
somebody that young get that?
she just did, yeah. She got a
Nutrition or what?
got a DEXA scan, or maybe her doctor recommended it. But in 2 years, she showed a 13% improvement. But again, she I don't think she's missed a week in 16 years. I mean, she is there every single week.
Good for her.
Yeah, maybe one or two like on a vacation or something. But she got in 2 years gained like 13% and got out of osteopenia into normal bone tissue. Yep. So basically, if you're interested, what we do at our office is if anybody is interested, and I do this for anybody, I want people to experience, and I used to have people come in maybe once and just kind of see it, and I talk about it, but I really want people to experience it so they can see, because if you just come in once, you can see, okay, this is how strong I am. Okay, that doesn't tell you anything. So we let people come in for a whole month. I don't even charge, just so they can kind of see what they're doing. And then they can see, okay, this is the strength gains that we showed just in those 4 weeks, and they get a better idea. They can see, oh, I was better this 4th week than the first one. You know, the balance is a little bit better on the power plate, so they can just feel improvement on their own. And so we do all that. I did forget my pamphlets. I was running out there. They're on my desk, but I can get them to Dr. Lynn if anyone's interested, just on basically what it is. It's a little bit more information that you can read on that and everything. And, or if anyone's on Facebook and wants it, they can get them too. So other than that, that is basically how we go about remodeling and rebuilding the bone tissue without drugs, but be doing it in an alternative way that has been very, very efficient and successful in our office.
So how often is this that a person does this in a month? Like
So yeah, so
once a
we
week, or-
like people to come in once a week. I don't think I mentioned that. We want people to come in once a week, and only once a week, because we need a good 5 days of recovery time before we do it. So if you do the same thing, like say Monday, Wednesday, Friday, you're never giving the bones a good chance to heal. So when we heal is when we're not doing it. When we're stressing the bone, we're breaking it down, and then it allows it to rapidly heal.
Huh. Wow.
So
That's very cool.
yeah.
Very good. So if you have any other questions, stick around. You can ask them Dr. Craig then. That'll be awesome. Thanks for coming tonight, buddy.
Yeah,
appreciate you being here.
Yep.
And something, Nancy, you said, I wanted to make sure I address this real quick. You asked how these things benefit, and how does a person that young get osteoporosis or osteopenia? Well, certainly going through menopause can do it, but then also being inactive. And then one thing they're learning actually from teenagers now is actually drinking carbonated sodas.
Yeah.
The phosphoric acid in those things, phosphorus and calcium are always competing for these things in our bones, and the more soft drinks you drink, they're seeing kids actually, in some cases, actually having fractures in their hips and long bones that you should never see in a teenager, just because all they're drinking is soda. That doesn't go, it's not with like diet. Diet is just as bad as regular soda. And then Dr. Craig mentioning proprioception. That's one of the best things that happens with power plates and programs like this is that's actually, I think of it like the sixth sense. All of us remember the five senses we learned in school, right? Hearing, seeing, taste, touch, smell. Well, there's a whole bunch of other ones too, and one of them is your ability to know where you're at in space, and it's something we tend to lose with time as we don't do certain things, right? In grade school, elementary school, we're playing sports that involve lateral movements and all these things, climbing jungle gyms. Since about age 21, what have most of us done? We walked in one direction, maybe walked some stairs and things like that. So you lose that ability. So if you start to stumble and you can't catch yourself, that's when you go down and break something. Well, proprioception is the ability to tell, like when my eyes are closed, I know my hands are over my head because I have these joints that are firing and my skin and everything. Those get much more efficient when you do things like this. So older people who maybe stumble can catch themselves in time before they fall and break something, which is how I lost my father. I lost my father to a hip fracture. It took him 5 weeks. He broke it and all the sequelae from the surgery and things like that too. And it's really a sad thing. And it's actually the 5th leading cause of death among seniors. So it helps in so many ways. It was really amazing. So thanks for coming and sharing your
Wow.
thing.
Yeah, thank
Appreciate it.